Benzodiazepines are among the most commonly prescribed depressant medications in the United States today. More than 15 different types of benzodiazepine medications exist to treat physiological and physical problems. Benzodiazepine medications, such as Valium, Xanax, can vary on the amount of time it takes to produce an effect. Three types distinguish benzodiazepines: short-acting, immediate-acting, and long-acting. Benzodiazepines inhibit the central nervous system by enhancing the effects of the major inhibitory neurotransmitter, gamma-aminobutyric acid, or GABA. Neurons that have GABA receptors are suppressed. GABA reduces the ability of neurons to communicate and transport messages to one another, limiting brain activity and producing a state of calmness. Due to the effects of increased GABA, benzodiazepines are prescribed for their ability to produce anxiolytic, hypnotic, and sedative effects in patients. Benzodiazepines are prescribed to help relieve anxiety, treat neurosis, relax muscles, alleviate lower back pain, treatment of some convulsive disorders such as seizures, induce sleep, and relief from withdrawal symptoms associated with narcotic and alcohol dependence. Some immediate side effects that a person may experience are lack of energy, confusion or dizziness, euphoria, mood swings, slurred speech or stuttering, impaired perception of distance and movement, blurry vision, short-term memory loss, or slow reflexes. Over time, a person who is using more than what is being prescribed may experience short and long-term effects. Short-term effects include confusion, depression, feeling of isolation, respiratory depression, nausea, dry mouth, abdominal discomfort, loss of appetite, and diarrhea. Long-term effects include lack of energy and loss of interest in performing mundane or daily routines, chronic headaches, a diminished libido and sexual performance, skin rashes, a growing appetite and weight gain, menstrual problems for women, dreams that make a person feel bad, and muscle weakness. Abuse is frequently associated with adolescents and young adults who take the drug orally or crush it up and snort it to get high. Due to its euphoric effects, benzodiazepines are abused in conjunction with other drugs and substances. For example, abuse is particularly high among heroin and cocaine abusers. Cocaine addicts use benzodiazepines to relieve the side effects of irritability and agitation associated with cocaine binges. Benzodiazepines are also used to minimize alcohol's effects and regulate withdrawal symptoms. Some people may use benzodiazepines in the form of injections. This method carries significant risk, such as a collapsed vein, vein damage and scarring, ability to transport blood, loss of limbs, damage to organs, stroke, and possibly death. Injections may also produce infections such as hepatitis B, HIV, and AIDS through the use of sharing needles. Although it is unlikely to overdose on benzodiazepines alone, using the drug along with other depressants or narcotic drugs can increase risk of overdosing. In 2014, the National Institute on Drug Abuse reported that about 8,000 deaths occurred in the United States,